Hi, I'm Amelia Robinson, the Columbus Dispatch's opinion and engagement editor. Welcome to Columbus Conversations, an urgent appeal for help stopping the COVID-19 surge. This is the latest in a new series of town halls that we have created to explore issues important to this community. The coronavirus definitely falls into that category as we head into the holiday season. Like those elsewhere in the state, nurses, doctors, and other healthcare professionals in this community are pleading with the public to help beat back the pandemic that has already claimed more than 800,000 American lives. I'm joined by a panel of experts from local hospital systems um, that were organized with the help of Central Ohio's Hospital Council. Also with me is my colleague Max Philby, who has been covering the pandemic's impact on Greater Columbus from the very beginning. Max reported just yesterday that COVID-19 cases in Ohio hit a new record for a single day, 12,502 people. As always during these talks, you can join in by submitting questions to our panelists in the Facebook chat. Max and I will get to as many of those calls as possible. This event is part of the Dispatch's celebration of 150 years of service to Columbus, Central Ohio, and the rest of the state. You can support local programs like this by subscribing to the Columbus Dispatch at dispatch.com/subscribe now. On to our fantastic panel, which has, obviously they've taken time out of the holiday season and their busy lives as medical professionals in Central Ohio to join us. So we thank them for that. We have Dr. Annie Thompson, who is the Chief Clinical Officer at Ohio State's Wexner Center. We have Jerry Mansfield, who is the Chief Nursing Officer at Mount Carmel. We have Dr. Joseph Gastaldo, Systems Medical Director of Infectious Disease at Ohio Health. Dr. Russie Morris, who is Chief Medical Officer at Nationwide Children's Hospital. And last but not least, we have Bruce White, who is the Chief Executive Officer at Knox Community Hospital. So thanks for joining us, gentlemen. I really appreciate it again. So we're just going to jump right in here. The title of the talk is, what should people do to stop the COVID-19 surge? What are the things that you want the public to do to help stop this pandemic?
So I'll maybe take the swipe at that first and then let others join in. I think at this point for the pandemic, what we're seeing is really the importance of the need for vaccination. And if you have been vaccinated in the past and you're eligible for a booster, to get a booster dose. While the vaccine effectiveness in terms of people getting the infection is down a little bit from the other variants of the virus, what we know is that the vaccine is still very protective for severe disease. So the risk of getting pneumonia, the risk of needing to be in the hospital, or God forbid on a ventilator, is still significantly decreased with being both having the vaccine. And if you had the vaccine months ago and you're eligible, it would be time to look for a booster dose. So that's kind of idea number one. Idea number two is really when you're in public around a group of people who you don't know their vaccine status, you don't know if they might be ill, essentially in any public space, especially those where you can't control your physical interactions with others, you really need to be wearing a mask. I think the contagious nature of this new Omicron variant is significantly higher than the Delta variant, which was significantly higher than previous versions of the virus. But what we're seeing is really case numbers in the Northeast Ohio area that are 9 to 10 times what they were just 6 weeks ago. We are lucky right now in Columbus that we are not seeing those same numbers, but we expect in the next 2 to 3 weeks that we will. So see this as a wake-up call that it's time to get vaccinated. If you're not vaccinated, get your booster if you haven't and you're eligible. And please, when you're in a public setting, in a store, at your child's basketball game, whatever it is, please wear a mask. It's really important. Joe, you maybe take a crack at that.
There you go. I was able to unmute my mic. Thanks, Andy. I appreciate all the comments you make, and I want to echo them. We really want to let people know our current situation of where we're in the setting of the Omicron variant. You know, the CDC once a week leaves a variant report that's available to the public. It's called the Nowcast. And in the Midwest, 92% 92% of what we are seeing is the Omicron variant. And as Dr. Thomas said moments ago, the Omicron variant is now king of the mountain as far as how contagious it is. Delta in the public doubled every 7 days. With the Omicron variant, it's doubling in the public every 2 to 3 days. So this specific variant is more contagious, and we really want everybody to understand the tools that we have to best protect yourself. We're all familiar with the tools we have, like masking, paying attention to the ventilation of air, things that we've been living with now for over a year. But what's different this year is obviously vaccines. Vaccines are still performing well with what they were intended to do against Omicron, to really mitigate or prevent or really give a great layer of protection against severe disease like hospitalization and death. In addition to that, we also too need to be on point for home testing. A home test is a snapshot in time to let you know if you are contagious with a virus that causes COVID-19. Home antigen testing will detect the Omicron variant. And I can tell you, in my personal life, in addition to everybody being vaccinated and everybody being boosted, everybody's going to do a snapshot home COVID test right before we get together before the winter holidays.
Great, thanks, doctors. We've got a comment from one of our viewers, Gina Allen, who says she is not vaccinated yet, never will be, nor will her children. 2 years into the pandemic, we've got a lot of people still questioning whether the virus is real or not, even, surprisingly. We've got a lot of people who are skeptical of the vaccine safety. So what can you do to convince people to get the vaccine, especially some of those holdouts out there?
I'll take first jabs at that. So we are now in December of 2021. We started vaccinating people in December of 2020. To date, we have given close to 500 million doses of these vaccines, and specifically with mRNA vaccines, billions more worldwide. And I have the utmost confidence in the review process at the level of the FDA and the CDC, and the way our country reviews vaccines in an open and transparent way is the gold standard of the world. In addition to that, on purpose, the FDA and the CDC built transparent, robust, detailed mechanisms to ascertain for any safety signals. Those mechanisms have served us well. We know about 3 very rare adverse related reactions to the vaccines. And when you look at all of those individually, the benefits of getting the vaccine far outweighs any risk. Nonetheless, in the setting of the Omicron variant, in the setting of this coronavirus, it's not going away. Everybody has a date with this virus. Unless you live on top of a mountain or you don't have any interaction with the public, you all have a date with this virus. As an infectious disease physician, I want everybody to have a wonderful layer of protection against severe disease, and the safest way to do that is through a vaccine.
Rustin, do you want to cover, since they mentioned their children, you want to cover the safety with kids?
Yeah, I thank you, Andy. I think I would just also offer that you should probably listen to the press conference and the testimonies from the frontline nurses in the adult hospitals yesterday, just to hear their gut-wrenching stories about adults who are dying, and primarily they're unvaccinated. And I can tell you in the pediatric realm, we're fortunate that this disease is not hitting the children as hard on a physical health perspective, but of the children who are hospitalized and the children who are in the ICU, they are all unvaccinated for those who are eligible to be vaccinated. So we're not seeing in pediatrics the same as the adults. The children who are getting ill are unvaccinated. It too, as just to reiterate what Dr. Castaldo said, it is a very safe vaccine. It's been tested and proven to be safe in children. We're not seeing adverse reactions from it, no more than we would with any other vaccine. So I think it's time to move past this questioning the efficacy and the trust of the vaccine, and do your part to keep yourself healthy, and especially your children, because we don't want to see children getting hurt from this virus so they can avoid it.
So what has kind of struck me is how the hospital systems have kind of come out in force and together and said, please help us do this. In Cleveland, obviously, I guess they had an ad in the paper today that said help. as the primary thing. What exactly is the situation in hospitals? What's going on right now in your medical facilities?
One of the things I'd like to add, and it's already been mentioned, I think this is an important thing for folks to watch if you've not watched it. So yesterday, there was a conference held at Columbus Public Health. The title of it was Frontline Nurses Provide Update on COVID-19. It was an extraordinary expression of what 3 nurses in our Central Ohio community see every day in the work site. So the people that spoke, Nate Royster, who's an RN who works in the emergency department at Ohio State University Wexner Medical Center. Jennifer Hollis, who's a nurse, works in critical care at Ohio Health. And then finally, Tracy Hayes, who's a nurse manager, works at Mount Carmel St. Anne's. Each one of them have a different perspective. Each one of them have a different reaction to what they've been experiencing, but each one of them expressed the same perception that folks need to take this very seriously, that what they're seeing every day in the hospital setting is frightening. It's things that they've never seen before in terms of the volume in which they've seen it. So if you haven't watched it, I'd encourage you to do so. It might enlighten your perspective.
From a small community hospital's perspective, I'd just share some numbers. Yesterday, our hospital has 69 beds, inpatient beds. 18 of those were filled with COVID positive patients. And I take that back, 19 were filled with COVID positive patients. 18 of them were unvaccinated. Only one was what people refer to as a breakthrough case. And so I think in addition to what has already been said about the safeness, the efficacy, and so on, I think it's been proven, at least in our small hospital, that the people who are coming in with COVID are the unvaccinated, and they're requiring that higher level of care that an inpatient stay requires. So while I can sympathize and empathize with people's hesitancy to a certain degree, I would say keep an open mind, keep trying to learn. Please don't make a decision from which you say, I'm never going to change, because new information is coming around all the day, continued use of the vaccine and what we're seeing. I think you want to always be open to continue to reevaluate and assess that.
What are you seeing, Jerry?
Right now, our COVID numbers are hovering around over 130 per day. We've seen a gradual increase since October, and it's just been on a steady incline. Patients in the ICU, similar to the other expressions, around 20% or so are vaccinated, and in the general care areas, about 26%. So the interesting portion of that is that that while vaccinated may not prevent a hospitalization, it certainly can mitigate the seriousness of it. And those individuals who are vaccinated and are in the intensive care unit on a ventilator typically have other medical conditions that have complicated this disease, whether that be a heart condition, a lung condition, diabetes, et cetera, or any combination of those. So what we're seeing, and not only is it just gets a person hospitalized, the length of these hospitalizations is quite striking. I can mention yesterday we had 2 patients that were at least well enough to leave our facility and to go to a long-term acute care hospital. But unfortunately, they decompensated within the previous 24 hours of admission and now are on a palliative care unit intending to withdraw life support. This is very serious. People have to take this current condition of where we are right now. While it is less numbers than we were at our last surge last year, we have every indication to know that that's going to increase over the next 4 to 6 weeks here on Central Ohio. So everything that the physicians are asking all of us to do with vaccinations and boosters, the social distancing, the masking, hand washing, those things are still in effect. And what's even more important is that we have been dealing with this now for over 600 days. And the staff in the hospitals who have dealt with this daily are extraordinarily exhausted and tired.
Yeah, I'll add a couple things on what's going on at Ohio State. So this morning we were sitting at 114 active COVID patients in the hospital. But to Jerry's point about the extended hospitalization, if an individual gets the COVID pneumonia and needs to be in the hospital, their isolation period is actually 20 days. So we have typically on each day an extra 25 or so patients that are past their 20-day isolation marks and others. They were diagnosed over 20 days ago, so they're no longer in kind of acute isolation, but they aren't well enough to go home. So that 114 number is really well over 130, probably approaching 140 in terms of the actual impact. So thinking about people in the hospital for 20 plus days, this is a major disease when it hits you. And the majority by far of individuals that are being admitted to the hospital here at Ohio State with active COVID disease are unvaccinated. So we're running about 20% of our COVID admissions are vaccinated, but a large percentage of that 20% are actually here for something else. In other words, they're being admitted to deliver their baby and they test positive when they come in, or they have medical conditions like they've had a kidney transplant. We know their immune system doesn't work that well. Maybe the vaccine didn't do enough to protect them. So when you think about 70% of the adults in Ohio are vaccinated, but that represents 10 to 20% of the admissions in adult hospitals with COVID. I mean, you do the math of which it's safer to be vaccinated or unvaccinated in terms of the risk of being in the hospital. Also, I can't stress enough where we started that this Omicron variant is just significantly different. We started to see yesterday the first of businesses that have had to close. I believe it was in Heath. Max probably saw the story. In Heath, a Walmart that needed to close because they had so many staff out sick. And I believe they closed the second day today. So, I'm sure that's not fun for that company at the holiday season. I'm not sure it wouldn't be fun for a fast food restaurant company to have to close locations because they just don't have enough staff to be open. It really comes down to those things we talked about. Get vaccinated. If you've been vaccinated, get boosted if you're eligible, and wear a face mask when you're around others in public. To really reduce your risk if you're an asymptomatic or pre-symptomatic positive of giving it to anyone else, and to reduce the risk of you getting sick too.
Thank you. With the holidays approaching, we've got Christmas this weekend and New Year's just a week away. Obviously right now tests are a little harder to come by with everybody trying to get tested right before the holidays. And as you just mentioned, Dr. Thomas, with the Omicron variant showing up over the last month, is there anything people should be doing differently to celebrate holidays, or should they be canceling family gatherings and holiday parties?
Joe, you want to
Well,
take that?
I'll take a first step at that one. Obviously, it's December of 2021. We have the tools available. I could share with people what I'm doing in my personal life, but obviously, let's kind of get back to basics. First of all, if you are symptomatic with anything that may be suggestive of COVID-19, isolate yourself and get tested. I know home antigen testing is out there. Supply is hard to get, but PCR testing, I know at Ohio Health at Ohio State is still available. So still, you should sequester yourself and get tested if you have symptoms. Second thing, let's kind of go through the layers of protection you have. Obviously, as Dr. Thomas mentioned, the best layer of protection you have is to get a vaccine and get a booster if you're eligible. In the state of Ohio, roughly only 40% of those people who have gotten their primary series have been boosted. So there's opportunity in that regard. The second thing, as Dr. Thomas says, is if you are going to be indoors with a group of people, unvaccinated people, that is a riskier scenario with getting this very contagious variant. And in that scenario, mask wearing should happen. When you're indoors, you want to pay attention to the ventilation of air. If there's virus in the air with appropriate ventilation, the ventilation helps get rid of the virus as it's in the air. Have access to home testing if available before you get together in a group. In my private life, in my family, I'm one of 5 kids. We are going to have hopefully a normal Christmas Eve meal with my parents who live in Gahanna. Everybody's going to be vaccinated. Everybody who's eligible for a booster will be boosted. And right before we get together, everybody is going to do a home antigen test. And remember, that test is a snapshot of time to let you know if you're contagious with this virus. With COVID, and specifically this variant, there is no such thing as zero risk. However, we have the tools available to really make it as low risk as possible.
So this question came up just yesterday in our Facebook group we have for readers, Columbus Dispatch Conversation. Why should people who aren't vaccinated care to be vaccinated if they don't affect other people? In other words, I'll flip that around actually. If you are vaccinated, why should you care if other people aren't? What is the impact that unvaccinated people have on the vaccinated?
Yeah, I'll take first stabs at that. So first of all, how a vaccine performs in the real world is what is defined as a vaccine effectiveness. And when there are more people vaccinated, the vaccine effectiveness for everybody is much better. Let me explain it to you another way. The purpose of wearing a rain jacket is to keep you dry if it's raining out. That's the vaccine working. So if it's only sprinkling out or a light rain, the rain jacket is going to keep you dry. But if you're in a heavy thunderstorm or a monsoon, the rain jacket, you're going to get wet in the setting of a monsoon or thunderstorm. And in the setting of COVID-19 right now, we are in a monsoon with widespread contagiousness of the Omicron variant. So the reason why we really want everybody to get vaccinated is because that improves the vaccine effectiveness for everybody. More people who are vaccinated, community rates of transmission go down. That improves vaccine effectiveness for everybody. And remember too, vaccines are not foolproof. When you talk about vaccines and immunology, it's full of caveats. There are a significant amount of people where vaccines are less effective. Elderly people, vaccines don't work as well. Certain medical conditions, immunocompromised states, those on medications where vaccines don't work as well. And if we get more people vaccinated, there are lower rates of community transmission, and that really helps improve the vaccine effectiveness for everybody. You know what? Getting vaccinated too, it's an act of kindness. It's an act of caring for your community, for your family, and for your hospital and healthcare system.
You know, I'll add to Joe's comments. I think if you were to be an individual living in Northeast Ohio who was planning to have a surgery at the Cleveland Clinic, Metro Health, or University Hospitals of Cleveland, or now someone who lives in the Central Ohio area and we're planning to have surgery, frankly, at about half of the 40 hospitals and health systems in our region, that's canceled or postponed now. When you talk about the impact of the unvaccinated driving hospitalizations, and it's starting to affect everyone else's care. We are on citywide divert in our emergency departments multiple times per week now. On our worst days across our zone of 40 hospitals and health systems, we have, over 200 patients that are in an ER waiting for an inpatient bed, but there's no bed to put them in. So I don't know how else to explain it to people beyond the fact that at some point there is no more elasticity left for hospitals to just make more space for people. So when the ICU beds are full and you come in with your heart attack and need an ICU bed, I'm sorry, you may not do as well because your neighbor didn't want to get vaccinated or your cousin didn't want to get vaccinated. If you come in with a stroke, you might have to stay in a hospital that doesn't really provide stroke care because the hospitals that do provide stroke care don't have any beds for stroke patients. So this is a major public health issue. Although the risks for any one individual might be low, you add that up across a region or across a city, the impacts for all of us are really, really significant. And frankly, they're only getting worse. In Northeast Ohio, they're talking about people with COVID being on the ventilator for 2 to 3 days in the emergency department because there are no ICU beds left. That is not the standard of care that people in this community expect from their hospitals, and certainly not the standard of care that we want to deliver. But I don't know the alternative. If people aren't willing to protect themselves, we are not going to walk away from unvaccinated people and not care for them. But at some point, this impacts everyone. So if you can talk to your cousin, talk to your neighbor, talk to your friend from work, talk to your friend from church, and help explain to them why this is important, that would probably be as important as anything coming out of this session.
Now, Dr. Thompson, you bring that up, and that actually, a scenario you mentioned earlier where you were sick with something else and you go to the hospital, actually, and it's not a bed for you, happened to a relative of mine where they were treated, but they left early because of the shortage of beds. They were, sent home much earlier than they would have earlier. What are there things about what's going on now that give you guys hope? We were talking about this, and there's lots of reasons to be concerned, but are there things that give you hope that we might be turning the corner on this?
Yeah, I think the good news, if there is any good news about the Omicron variant, is it does appear to be a little less virulent. In other words, when you think about the three characteristics of any of these variants, is it more contagious? Clearly, it's more contagious. Is it more virulent, or does it, on average, make people sicker or less sick? This appears maybe on average to make people a little less sick, especially if they're vaccinated. That's a good thing, that the importance that vaccines are helping prevent serious illness. The problem is if it's, the cases in Cleveland are 9 or 10 times higher than they were just on November 1st. If your cases go up 4 or 5 times that where they were, if it's 25% less virulent, those two things balance out and you end up with more people in the hospital. And then the third point is, does the vaccine still cover that variant? And as I said, the vaccine effectiveness for getting the infection seems to be a little bit lower based on the published reports and certainly our experience of people with what's called a breakthrough case. But really the number of folks that are needing hospitalized who are fully vaccinated is still quite low as a percentage of the total population. So that maybe is a bit of a long-term silver lining of this variant, is that the virus is progressively getting less virulent. But the risks of taking that chance are still, as a community, are still pretty high. The other thing is this week we should be getting the first FDA approval for some oral therapies that will reduce risk in high-risk patients for need for hospitalization. This is similar to a drug called Tamiflu that was developed originally during the H1N1 flu pandemic a number of years ago. It's an antiviral drug that will help boost your ability to fight the virus once you are infected. Those should receive FDA approval, hopefully, I've heard as early as this week, maybe next week, and those might be in our hands here in Central Ohio soon.
Sounds good. We've got a comment from a viewer, Amy Walters-Wyrick. She's asking, can you guys clarify a little bit, and I've heard this before too, you hear people talk about, did somebody die from COVID or did somebody die with COVID, maybe because they had an underlying condition and whatnot. Can you clarify a little bit about, what you mean when you say somebody dies of COVID?
Sure, I'd be happy to take a crack at that. Maybe Joe, then you can chime in as well. So, I don't remember the last time that someone died of a heart attack and they said, oh, but it wasn't a real heart attack because they were diabetic. Or someone who dies of lung cancer and they say, oh, it wasn't real lung cancer because they smoked. So the mere fact that people's ability to fight this virus is to some degree based on their underlying health conditions at the time they get the virus is just a natural part of actually what we see every day in clinical medicine. If I take an 85-year-old and give them pneumonia versus I take a 35-year-old and give them pneumonia, the outcomes of those two patients are going to be different because of the resilience and the ability to fight that infection in an older patient or a patient who's had a transplant or has cancer and is getting chemotherapy. So I think trying to say that some things are real COVID mortality or not is not really accurate. The thing I will say about, I mentioned earlier, someone coming in to deliver a baby and testing positive for COVID, or someone coming in with a trauma with a femur fracture and testing positive for COVID. It's really important to count those people as COVID patients for two reasons. First of all, they still have a risk of transmitting that to other people. So our staff, in terms of how we protect other patients, other families, and our own staff, need to treat that patient as if they have COVID because they do. That may not be why they're here. It may be a mild case of COVID, but we can't afford to have our staff get sick, other patients get sick by, for example, by putting them in a semi-private room or in some other setting where they could get someone else sick. But second of all, there's this term pre-symptomatic. So some people may develop symptoms 24 to 48 hours after being infected with the virus. And just because they don't have symptoms on the day they're infected doesn't mean they aren't going to be sick 3 or 4 days later. So we really test every admission still to the hospital, mainly so that we can keep our staff and other patients and other family members safe. But the number of people that are in the ICU on a ventilator, those aren't people that are there for other reasons and just happen to have COVID. They're there because they have COVID. So I don't know if that answers the question, Max, or Joe, if you have anything else you'd add.
Yeah, Andy, I agree with everything you said. A lot of it has to do with the person who actually has infection. A young person who gets infection with this contagious virus may do well, but if you have underlying heart disease or you're a brittle, frail diabetic, or you have underlying medical conditions, if you get COVID, that's really enough to tip you over the edge to have a heart attack. to have uncontrolled diabetes, to have a flare in your underlying medical condition. You know, everybody's ability to respond to this virus and really fight it is quite dependent upon their age and their underlying medical conditions.
Well, we obviously can talk about this for hours, but I want to keep to what we promised our medical professionals who are very busy, especially fighting this horrible disease that has killed so many Americans and other people around the world. I want to thank you all for joining us for this important talk. This conversation is going to continue on dispatch.com and in our opinion page chat, the Columbus Dispatch Conversations. I want to once again thank our panelists.
I don't want you to cut me off yet. I got one more thing to say.
Oh, you do? Okay, go for it. But I'm giving the credits now, man. Do you want to?
I know. This will be fast, I promise. You know, a lot of folks have been talking about where have all the nurses and doctors gone? What happened to everybody that's supposed to be caring for us? And I can tell you it's been very difficult to recruit staff into hospitals at the present time. And it's important to know that there was a recent study that just came out. And I'm going to quote a couple things from it. Because not only is this is what we're dealing with now, is how has the past 600 days affected healthcare nationwide? So the study was done between July 1st and December 31st, 2020. They surveyed healthcare workers. Do you intend to stay in your profession and or would you leave? And what they found in this survey, 20,665 people responded. And what they said was 1 in 3 physicians, advanced practice providers, and nurses intend to reduce their work hours. 1 in 5 physicians and 2 in 5 nurses intend to leave their practice altogether, all because of what they have been dealing with over the last 2 years. So, ladies and gentlemen, when you hear the words of the stories from those nurses yesterday and our healthcare professionals imploring you to get vaccinated and boosted, it is not just about what's happening now. It's what might be there in the future, come 1, 2, 3 years from now, when you need care and you look up, somebody may not be standing by your bedside. Thank you.
Well, that was definitely something we wanted to get in there. So thank you for interrupting me. We have a couple people who want us to continue, but I know you guys are very busy, so we can't do that just before the holidays. We'll be, coming back to this conversation, unfortunately, because the pandemic doesn't seem to be going anywhere anytime soon. But we just wanted to do this so people can have as much information as possible, particularly since so many families and friend groups are going to be gathering for the holidays. I want to thank our panelists. We have Dr. Andy Thompson of Ohio State University's Wexner Center. We have Jerry Mansfield from Mount Carmel. We have Dr. Joseph Gastaldo from Ohio Health. We have Rustin Morris, who is from Nationwide Children's Hospital. We have Bruce White, who is from Knox Community Hospital. Watch for Max's work. He's been working his tail off to get the information out to the community, as have others from our staff at the Dispatch. You can find it in the pages of the Dispatch or on Columbus Dispatch's website, dispatch.com. The most important thing we want you to take away from this is, enjoy your holiday season, but do it as safely as possible. On behalf of the very hardworking journalists at the Columbus Dispatch, we wish you guys a very Merry Christmas and a wonderful New Year. Thanks a lot.
Thanks for having us.
Thank you.